I'm Dr. Enoch Choi, and I'm so glad to be a part of the editorial board of MD Net Guide, which is part of HCPLive. Thanks for having me today. I was the moderator of a panel of Doctors 2.0. We were a group of physicians that are excited to be offering products that are hoping to revolutionize the way that we're interacting with our patients through the documentation we do, through the orders that we make, and through the records that we want to review, not only from our own records, but from disparate records that are going to be interfacing with our own. The companies I had a chance to moderate of the panel today were James Aida of Medicom, Tom Giannulli of Hippocrates, and Bob Rogers of Pix CEO. I was really excited about these companies because I've, over the last 10 years, I've had a chance to work on electronic health records at Palo Alto Medical Foundation. I've been a developer. I've worked on the documentation tools and the order sets and the templates to be able to make our work more efficient, and I'm really passionate about reducing the number of clicks and the kind of complexity that it takes for us to document and do our orders. I was really excited to be able to see the work with Medicom that dynamically brings up different choices for us to be able to choose the parts of the history-present illness and the right orders and things that will really make it easier for us to have a full documentation of the review systems, because what I use now are text-based templates that are they're ones that I've developed for different conditions, and it's really, they're very, very lengthy and complicated. What's really great about Medicom is that as you enter different items, it uses a clinical decision support tool that brings in only what's relevant so that you have less choices. If I have less choices, I have less complexity on the screen to see. I can just pick what's relevant, and as I pick, choices are taken away so that it's less and less cluttered, and only the relevant points that I need to document from my history and physical and my assessment plan are available to me, which I think is really pretty revolutionary, and it works with many different EHRs. I thought that was really great. The next product I had a chance to moderate was Tom Giannulli's Hippocrates SaaS-based EHR, and they have a web-based or iPad-based documentation templates that they're able to have different hierarchical menus that allow me to be able to choose that I can also customize myself and be able to use a web-based tool, and all-in-one EHR with an accompanying iOS app on the iPhone that would allow me to review those and also do some e-prescribing. So I thought that it was a great example of the stuff that I tried to do a dozen years ago at Medical Logic. I was a product manager there, and we had an app that worked asynchronously, like this Hippocrates app, that even if you lose connections, you can cache it and then load it back up to the server when you actually get reconnected. So it's a number of dreams realized in an even more fully functional product than we were able to do a dozen years ago. I'm so excited about Hippocrates' product. Finally, we had work with Bob Rogers of Pix CEO, sharing how their product is able to draw in the disparate records of all of the different people that can create a CCD, put those in a central repository, and search across that like you can do a Google search on general health information. You can use the Pix CEO to be able to do health searches across all of the different CCDs that you can, that your partners are willing to give you. And why that matters is that, oftentimes there is information that's contained in the hospital records, in other specialists that you've referred your patients to, and you don't have the records until they've sent it to you. To be able to do searches across all those records, to be able to document the improved care that those specialists and those hospitals have given, and update your own records so that you can be able to qualify for the kind of pay-for-performance measures and the different quality measures that you need to do in your own practice to show that all this work that you're working with these other partners, as we come on to the need to work with ACOs to prove that we're providing better quality and better, higher compliance with the kind of pay-for-performance measures that we need to have. Tools like Pix CEO, I think, are going to be really important to be able to search across not just the EHR records that we have, but across all of the records that we can possibly do. And Pix CEO seems to do it better with the NLP kind of analysis to draw out the clinical terms and be able to see that so that we can add that to our own electronic health records. So I'm really excited about the tools we had a chance to see today. I'm hoping that they won't be too expensive, and the vendors promised me that they're trying to make these affordable. When we queried the audience today about the kind of people who were in the audience, we did have a number of dozen different people who were in each of these categories. People who were interested in using the tools to either improve their documentation with their existing EMR. There are many folks that had not yet adopted electronic health records, so they were interested in the Hippocrates tools. And there are also the most interest was actually with the final product that at Pix CEO, with people across many different institutions and small practices, large practices. They had a lot of interest in the Pix CEO to be able to drive to pull out that clinically important information. So I thought we had a pretty good panel today, and I had a great time singing. You'll probably see that as a YouTube clip somewhere about my love of electronic health records and my frustration with the lack of respect physicians get of our time and effort that it takes us to use our electronic health records. So I hope you get a chance to see that, and I'm hoping to continue to be a part of MD Net Guide, and I'm really thankful to them for their support. They've done a lot of promotion of the work that we've done abroad in Haiti and now Japan. Thank you, MD Net Guide, for running different teleseminars and promoting the work that we're doing philanthropically abroad. Thank you so much for being a part of that. I'm so excited to be a part of MD Net Guide, and I thank you so much for giving me a chance to chat today.